Hello and welcome to the terminology presentation video voice recorded presentation for 2019 for Nursing 212. Let's get started. So we have terminology, and here you can see the different terminology. By the way, I like the recording because if it's something that I'm talking too fast or moving along too fast, later on you can go back and pause and rewind and fast forward. Each of the presentations will be 15 minutes or less to keep everyone's attention. So when we look at bathroom privileges, when patients ask, can they go to the bathroom, or they're on bed rest, or on the, if the doctor said bathroom privileges, that means they can get out of bed with assistance and go to the bathroom. They can't go wandering around in the hospitals, up and down the units, outside the hospitals. It's bathroom privileges only. So we have to really be careful and inform our patients on what BRP stands for, and so they can understand it and not get upset. So the more knowledge they have about their care, the more willing they are to provide themselves in their care and be part of the care plan. Hemiplegia. There's different types. I kind of mixed all the words up because I didn't want to group them so you can learn what all this particular word mean and all what this other group means. So hemiplegia is that's the paralysis of one side of the body. Hemi is one side. So if a person had if they had paralysis, it would be one side of the body. For example, maybe their arm and their leg is paralyzed and they can't move, and sometimes they cannot feel on that one side of the body. Hemiplegia. Now lipoma. Let's switch it over. That's a growth of a fat cell under the skin. Sometimes people, or you may have a relative or a friend who have a lipoma. Basically, it's a growth of fat, and it's a cells underneath the skin, and you can actually feel it. And sometimes it moves around. Now, when patients go to surgery and they come back from surgery as registered nurses, after you guys graduate, you're going to become all registered nurses. Yay! So after the surgery, sometimes the wounds have problems. Maybe some infection or something is going on with the wound. And after the doctor has either put staples in the wound or sutured the wound, or maybe took the staples out, the sutures out, the wound decides to open. Dehiscence, surgical complication in which a wound ruptures along a surgical line and it opens. That's something you have to notify the doctor right away and cover the area with sterile dressing. So WA basically means while awake. There may be certain orders the doctor might say, do X, Y, and Z while awake. Phlebitis, that's inflammation of the vein. So we want to make sure when we're starting IVs or doing anything, we don't want to start an IV where a patient has phlebitis. You also want to monitor that site to make sure it doesn't get worse or increase in inflammation, because then if the redness and the swelling travels, it can turn into cellulitis. Not cellulitis. Yeah, I'm correct. Cellulitis. Okay, let's move on. Nothing by mouth, NPO. You will see that all the time. But some patients may say, oh, can I have just maybe a drink of water tonight? My mouth is so dry. I just need some water, just a couple of sips. You cannot give a couple of sips. You can't give ice chips. You can't give Jello. You can't give a small snack. You can't give any of that. The patient is nothing by mouth for a reason. Possibly for surgery in the morning or surgery that night. And a lot of times the doctors will put nothing by mouth after a certain time frame, like nothing by mouth after 11 p.m. tonight, or nothing by mouth for the next 3 days. It just depends on what the order says. Lithotripsy. That's a medical treatment used to treat certain types of kidney stones. Those stones can be also found in the ureters, gallbladder, or even the liver. So typically, basically, it's some type of ultrasound wave, shock waves that break up the stones into smaller pieces. Now you will see this term a lot, AC. It's before meals. So when we start our clinical rotations, you might see check the blood sugar, AC, or it may say blood sugar, AC, which means we check the blood glucose readings before meals. So it may say AC and HS. HS is at bedtime. So I said that there, but it's not in front that you see, but I just wanted to let you know HS is at bedtime. Ad lib is as desired. Now ambulate. You want to ambulate your patient. That's simple. You want to walk your patient. Oh, I can't get my, there we go. Here's some more terminology. Light sensitivity. That's a condition where bright light hurts the patient's eyes. So you want to kind of avoid it. It's called photophobic. In my line of training, I incur a lot of patients who have migraines in emergency room, and the light even in the hallway bothers them. So we try our best to turn the lights off, and I even sometimes give the patients a towel, a light towel, like a face towel or a small bath towel to put on top of their face to block the light out, because that will help decrease the headache the patient is having. Hemolysis. Sometimes you get calls from the lab saying the patient blood has hemolyzed. That's the blood cells breaking down, destruction of the red blood cells. So therefore, we can't use that particular specimen. So unfortunately, we have to explain it to the patient, and we have to redraw the patient. Sometimes they're not happy about that. Leukocytes. Basically, leukocytes, you're looking at those white blood cells. You might also see WBCs. Okay? Necrosis. That's the death of body tissue when too little blood flows to the tissue. That's when you might see the skin turn black. There's death of that tissue. So if you look at your skin, you'll see a nice color in your skin. No black is there. And I really mean it turns black. That's considered necrotic tissue. Death of body tissue. Now you might have a large liver. Hepatomegaly. Sometimes patients' livers are so large, when you're doing your physical assessment, you can see it protruding. Large liver, and they may also have other problems going on with their body. Oliguria. That's production of abnormally small amounts of urine produced by the body. So oli is too little or too few, and then of course urea is urine. So oliguria. So that's when we're monitoring the patient's output and saying how much urine output their body is putting out. Now earlier we talked about AC. Let's switch over here and talk about PC. After meals. That's the same as what we were speaking of, except it's after meals. So you might, the doctor may want a procedure after the meal is done. Okay, ambulate, PC, after meals. That was just a small example. So dysphagia, that's difficulty or discomfort in swallowing. Now, I would tell you, everyone has a way of learning this. I learned it by seeing the G. And don't ask me, but I see the G in here in dysphagia. So whenever I see the G, I think about when I gargle, and I go, or you think about a turkey, gurgle, gurgle. So therefore, there's problem swallowing. Problem swallowing. The reason I'm pointing this out to you, because there's going to be another terminology spelled almost exactly the same, except instead of the G, it's going to be a S. Dysphagia, which will be difficulty speaking. BM is bowel movement. You'll see that a lot. When was the patient's, and hear it, when was the patient's last bowel movement? Hematuria, basically blood in the urine. You will see this word again further on in lecture. Empyema, that's a collection of pus in a cavity of the body. You know how we talked about earlier about the wound dehisced? It could have had some pus in it, and that wound could not stay closed, and it opened up. Specifically, you see some of the pus in the body of the cavity and something called pleural cavity. It's a cavity that surrounds the lungs, the pleural space. Stat means immediately and as soon as possible. Not 1 hour, not whenever you think it's time, immediately. Okay, you want to get to that immediately. Bradycardia, that's abnormally slow heartbeat. Now, Normal is 60 to 100. So anything under 60 is bradycardia. Anything over 100 is tachycardia. There's more learnings about supraventricular tachycardia and all those others further in your learning. But right now, for nursing 212, let's just focus on anything over 100 is a fast heart rate. Anything under 60 is a slow heart rate. Then you have bradypnea, slow respiratory rate. That's 10 or less respirations per minute. And then you have tachycardia, which is what I had talked about earlier, is 100 beats per minute, over that. Tachypnea, elevated respiratory rate, patient is breathing fast. So we want to say they're tachypneic is how you say it. Okay, so C/O, that's when the patient complain of. So sometimes you don't have to write your words out so much and save your fingers. Complain of. Your diastolic blood pressure is the pressure, that's the bottom number, the blood pressure during the part of the heartbeat when the heart ventricles are relaxing. When a patient is disoriented, they're confused to time and place, and sometimes even themselves. HS, I talked about that earlier, hours of sleep, or at bedtime. High blood pressure. You see that? Our guidelines have changed. High blood pressure is 130 to 139 systolic, or 90 millimeters of mercury or higher diastolic. I didn't put my diastolic there, and I apologize, but the 90 is for the diastolic. Here's some more information on hypertension. I'll allow you to read that. Now, patients are sometimes incontinent, involuntary urination or defecation. You can be incontinence of stool or urine, and that's embarrassing for the patient. So we want to make sure that we try to just do everything secretly and, just be mindful. NKDA is no-known drug allergies, and you might also see no-known allergies. Out of bed, and that can be to drugs. We're talking about drugs, no-known allergies. The doctor just might just put no-known allergies. He don't know anything. OOB, that's out of bed. So PRN, range of motion, dysphagia, what I spoke to you guys earlier, that's dealing with speech. So difficulty speaking. CBC, you might see that, complete blood count. Dyspnea is difficulty breathing, labor breathing. So we want to make sure we know those terms. This is our last slide. It's dysuria, difficulty or painful urination. If someone in your family ever had a bladder infection, those are one of the signs and symptoms. Difficulty or painful urination. Sometimes patients are vomiting, or you might say emesis. Patient had 3 episodes of emesis today. Okay, and then you want to describe what it is. If it was a dark, brown, yellow, whatever it was. Gait, manner of walking. Same as when you want to know how they're walking, or is their gait unsteady or is it steady? And then last but not least is nocturia. That's a condition in which patients, they're waking up, they got to go to the bathroom, they go to sleep, they wake up, they got to go again. So they're having nocturia. I hope this was helpful with you. Also, you will have a terminology test after this presentation. And I will tell you that in class when your terminology test is due, and it also will be in your syllabus. Thank you for listening, and happy learning.